A major therapy that we deliver here at Cancer Wellness Support is working with clients with lymphedema management. It's a condition that can form after medical treatment or surgical intervention for people going through their active phase of treatment. And it can be when clients have come out of the therapy, they've finished all their treatments, and then they may develop it in that first 12 months to 5 years. It's a condition that is life-limiting. It is a condition that is very expensive to treat, and it is an incurable condition. It can often bring on an enormous amount of grief and loss and trauma for the clients, because if you think about it, you may have had the all clear, you've gone through the treatment, you've gone through all of the changes that you may have experienced in your cancer journey, and then you feel free. You feel like you can begin your normal life again, and then you develop this thing called lymphedema that you may have had no knowledge of before. It's obviously from the intrusion of the surgical treatments or the actual medical treatments. The lymphatic system is damaged, and people develop, and I'm sure you've seen people out there in the community with a pressure sleeve on, and we'll just use the arm for example right now, and because there is an enormous swelling, so rather than being able to have the lymphatic fluid flow through the lymphatic system and drain away as it normally did, it disappears into the tissues, and people develop swollen arms, swollen hands, or that can actually go through the whole body. As the years go on, people are trying to manage this condition. They are trying to actually be proactive and have lymphedema massages, but the costs are actually quite incredible. So when we talk about cancer wellness, we must always remember that we have accessible and affordable therapies. So rather than paying $230 for 90 minutes massage therapy for their lymphedema, we charge them $45. For an hour of lymphatic drainage, it's actually $35. So the client is able to access more continuously the therapy to try and hold them in a manageable space. When the client is actually diagnosed with lymphedema, it sets up a whole nother program of how am I actually going to go forward from my diagnosis with cancer, when I thought that I'd left it behind, and now I'm still connected to it. So we look at what else do we need to do for the client. I looked at our clients and I noticed that a lot of them depended just on the lymphedema massage, because you get an immediate result. You're actually being cared for. There is an incredible healing process that goes on when somebody is just touching and treating you with gentleness and commitment. And the client then actually can walk away and go, I walked in here and I was in pain, I was in discomfort, and I now feel good. The problem is there's so much more that the whole system needs to do, that you need to increase your capacity and the wellness of your whole system to actually help maintain your lymphedema. Maintaining means maintenance, knowing that it's incurable, but it is manageable. So we created a 5-pronged approach. It's like the magic 5. And so we look at nutrition, we look at movement and breath work, counselling and mindfulness meditation, lymphedema management from the lymphedema therapist, and pressure garments. What is unknown is the expense of the sleeve. So the pressure garment can cost $500, for example, and last around 6 months. It's very hot to wear in summertime, and people are resistant to wear it because it can be difficult to get on, even though the therapists work with them so that the pressure garment is actually measured correctly, it fits properly. But there's all those variables that go on, and of course knowing that it is so expensive, knowing that the person may not be able to afford to buy it, then Cancer Wellness does support those people on case by case to actually help subsidise the pressure garment for them. So in that five-pronged approach, that means that the client can commit to an overall lymphedema management process rather than being passive in their therapy approach by relying totally on the therapist to do all the work. We want them to be empowered and we want them to be informed so they can work with our nutritionists so that they have a specialised lymphedema nutritional approach. We know that movement is very important, so our movement groups cater for people with lymphedema. We have specialised yoga lymphedema workshops and lymphedema groups, and then of course with the mindfulness meditation, or if counselling if it's too raw for them on an individual basis. But it's about the meditation, is the breath work, the actual calming down and taking out a focused moment just on self. When the clients see the lymphedema therapists, the massages are very different from what you and I might experience with a remedial massage, for example. It's very touch and press. They need to work through the whole lymphatic system and prepare the body through the lymph nodes, through the back, moving up to shoulders, through the arms. So it's a process, gentle, that can take up to 90 minutes. In addition, Cancer Wellness has the SOZO machines that are placed at both centres. They're actually these piece of wonderful medical engineering that can actually measure the whole of your body fluid and be able to hive off what actually is the lymphatic fluid. And if we were able to have all of our clients come to us before pre-treatment, we're able to actually predict their propensity to develop lymphedema. So we'd be very proactive in the process with them and preparing their body pre-treatment, such as the nutritional approach, such as the movement approach, so that we lessen the impact that lymphedema has on them. The lymphedema, as I said before, is life-limiting. And if you think about it, if people have it actually in their lower limbs, how do you actually prepare yourself to get back into your job? How do you actually join the workforce again? Especially if they've got to stand for quite a time, they're not able to do that. So we do support our clients when they are applying for a disability pension. So we may be involved in actually writing letters to Centrelink to provide the actual truth of what that client experiences, the pain, the limitations, and of course the trauma that goes with it. So at Cancer Wellness, we know that our major therapy is with lymphedema management, and our idea is again to be able to prepare the people to not be so reliant on the work of the therapist, but become empowered in their own wellness to lessen the impact that lymphedema has upon them.